Last time I ever have to deal with you. Crazy.
Well, today's the day.
Today is the day.
Pretty exciting. So we'll go ahead and start marking you. Pull your underwear to where they would normally reside.
I guess, yeah, that's where I would usually wear them.
So we'll mark that.
I think that might actually change after the surgery, because like
Yeah.
it's always sat just under the,
Sure.
you know.
Yeah.
I never thought of that. Maybe that's gonna be weird, trying to figure out like a new underwear's placement.
Right.
You know?
That is funny.
So I'm sort of getting a feel for, you know, where the maximum excess is.
Right.
And because you have, you know, the skin laxity with stretch marks here, we really have to go up this high to maximally improve it,
Yeah.
which of course is the goal.
So surgeons draw on you just like a tattoo artist would sketch on a person before doing it or using a stencil. And this is just to help have guidelines when the surgery actually happens.
All right. Turn around 180. Let's face this way. And make sure we're coming in about the same level and direction. And you may have another little suture granuloma there, so we will just
Go in again and do that.
we'll just remove that. Everything else looks like it's healed fine.
Yeah.
So I mean, you have maybe a tiny bit of fat there. Looking pretty sculpted, but I think we can make it just a little better.
Sweet. The reason why they do this standing up is because they need to see how the skin would normally fall. If they did this on a table, it would look completely different.
Let's see, so in terms of weight,
The big question. Because it's obviously going to be more than the other ones.
yeah, significantly more.
If my guess is even remotely close to yours, I'll be very pumped.
Maybe as much as 1,000 grams, which would be 2.2 pounds.
I'm not close at all.
What was the
I was like 3.8 to 4.2 pounds, which would be
No,
like
it's
the
okay.
exact double.
Yeah,
No.
I doubt that. But
Yeah, it always
who
looks
knows?
like it's going to be more.
Yeah.
Yeah.
all right, we need to photograph you.
Yep.
Photograph the markings, so we'll have you stand here.
His blood pressure looks great. His math was greater than 90, but he said that was his baseline blood pressure as well.
Super.
Okay.
All right.
Good.
Well, we
All
can
right.
head back to pre-op.
All right.
Let's do this.
All right, well, today's the day.
Today's the day.
Step 3.
Oh, the big, the grand finale.
Yeah, for sure. I'm excited to be doing it for you. I think we're going to do the same approach that we've done for the other 2 surgeries. We'll use lots of local anesthetic before we get started, after you go to sleep, of course. And then right before you wake up, we re-inject everything. So my goal is literally for you to be pain-free or just maybe mild discomfort when you wake up.
I can't even. Okay, I had like the weirdest realization the other day. But whenever I sit in my chair, I always have like full contact of the flanks whenever I'm sitting down.
Right.
Which actually makes me really sweaty most of the time. But I feel like I'm gonna have to relearn how to sit down. You know what I mean? Because I've been so dependent on these my last 33 years.
Yeah, well, I think it'll be a much better feeling
I hope so.
to have this out of the way.
Yeah.
So it's so great to have you here again.
Thank you for having me.
We're going to take great care of you.
Yep.
And I will see you in post-op afterwards.
I would not have anybody else doing this for me.
You're so kind.
Thank you so much.
All right.
All right.
See you after.
Oh,
Hi, good morning.
very nice to meet you.
Nice to meet you. My name is Dr. Manchester. I'm
Nice
going
to
to
meet
be
you.
your anesthesiologist today.
Awesome.
All right, well, aside a moment, what are you having done today?
The flankplasty.
Flankplasty.
And probably a little bit of lipo and stuff like that.
Okay, yep. I'm just going to pull your chart up and input some of your vital signs. All right. So 128/71 is your blood pressure. Is that what you normally run?
Yes.
Okay. All right. And just in terms of your medical history, is there anything I need to be aware of, like high blood pressure?
No, just the Crohn's.
Crohn's. Okay. And you don't take any medications or anything like that? And have you been on steroids recently?
Well, yes. Yes, but maybe not the kind that you're thinking.
Oh, okay.
Yeah,
Gotcha. Okay.
Bodybuilding things.
Yes. Oh, no, I hear you. Okay. And let's see here. Simon, do you smoke cigarettes or drink alcohol?
No.
No to both?
No to both.
Okay.
I saved my liver for the other ones.
And let's see. What I know you've had surgery here before, but other than that, what surgeries have you had?
I've had a few surgeries actually because of the Crohn's.
Okay.
No intestinal resection or anything. It was all just like fistulotomies and like retouch-ups there.
Okay, and have you had any problems with anesthesia that you're aware of? No?
All good there.
Okay, awesome. Just in terms of what we will be doing for you today for your anesthesia, this is, 4 or 5 hour case or so. So what we're gonna do is I'm gonna get your IV started, and then before we even go back there, I'll give you some nice relaxing medication. It works very quickly and
I'm looking
helps
forward
sort
to
of
it.
just take the edge off.
Yeah.
And
Benzos
then,
and opiates.
and then once we get you back in the operating room, we'll attach all of the monitors, and of course I'll keep you closely monitored the entire time. And then I will drift you off to sleep with medication through your IV. Once you're completely asleep, I'm going to help you breathe with a tube that goes in through your mouth and through your vocal cords to help you breathe during the surgery. Now, like I said, this is a moderate length surgery, 4 to 5 hours. So that tube is helping you breathe for quite a while, and it does go through your vocal cords. So there's a chance, unlikely because I use the smallest tube we can and I lubricate it, but you could have a little bit of a scratchy throat afterwards. I hope that won't happen, but if it does, it's very temporary, as in it will go away in a few hours and certainly by tomorrow morning.
Perfect.
All right. And then, let's see, during the case, I will give you pain medication and anti-nausea medication because, unfortunately, nausea is the most common side effect of anesthesia. But you haven't had it before, so I'm hoping we won't have any issues.
Yep.
And then at the end of the case, we'll just wake you up, take that device that's helping you breathe out, and then we'll take you to the recovery room where we will watch you for between 30 minutes and an hour.
Perfect.
Just his IV is left.
Yeah.
Dr. Manchester, will you want a Foley for this case? It's scheduled for 4 hours, but I'm not sure if we're anticipating it to go a little bit longer.
I was actually going to ask about that. I was like,
Yeah.
have you
I
guys?
actually think we should put a Foley in.
Sure, okay.
Yes.
Yep.
Oh, fun.
But hey, you're going to be asleep when we put it in and
Yeah.
asleep when we take it out.
So what's the cocktail of choice today?
I'm going to be giving you midazolam, which, yes, is a benzo.
Yes.
It's very similar to like a Valium or an Ativan.
That's a top shelf product right there.
What? Yeah, exactly. And people always think, oh, this isn't going, I'm not going to really feel the effect of it or anything.
You
And
do.
you feel it even before it's like, very short between here and the operating
Yes.
room. And everybody always feels it before they hit the operating room.
I've never seen the OR. I can confidently say that.
Really?
Or I guess I never remember because
right.
I'll
Well-
always remember we wheel out and then all of a sudden
Well, that's funny because you are awake in the operating
Yeah.
room. You get yourself on over to the bed for us, and then we
Which
drift you off to sleep.
crazy.
And everybody thinks they will remember, and they never do.
no, you don't. This is my first Foley ever. For
Really?
all the surgeries I've had, close
Really?
to probably 20 surgeries now.
Yeah.
It's my first Foley.
Well, the good thing is you will be asleep. so
Exactly.
Will it be out
You won't even
prior to
remember.
waking up?
You'll be totally
Oh,
out,
thank
and it'll be out before it goes in, out before you wake up. So you will feel like you didn't ever have one.
Sweet. Well, forget this ever happened.
Right. Well, and Dr. Law or Pedro will place it.
Okay.
Yes.
I don't know if that's
have
worse
the-
or better.
All right, they ready?
It sounds like it.
Okay. Well, we are ready to give you the good stuff.
Sweet. All right.
Oh, should I take this off?
Probably. yeah.
Okay.
So
There you go.
I'm not even hear all your singing and everything anymore.
see you guys on the other side.
All right.
Alright, so this off.
Yeah. Have you seen those?
I don't have a single idea how I managed to convince the nurses to start filming when I have zero recollection of this. It must have been so anchored in the back of my mind to get every piece of content, because this, I do not remember this long tube coming out of my nose whatsoever. I was honestly not really conscious at that point. And now for my first words. How did it go?
What's up?
How did it go?
It went great. It went awesome. You look amazing. You're so excited. You high five. You're so excited. You're very happy.
Is my back snatched?
Yes, you look amazing.
Hell yeah. Time for the bodybuilding stage. I can't imagine wearing triggers and not having like that bulge at my back. How are you guys?
Good.
Everybody's good.
Everybody's good. I was with you last time in recovery. I'm working on my face.
How was the Foley catheter?
It was fine. It was fine. It was in and out, done. I know, right?
One of my biggest fears, I swear.
Simon, how are you?
I'm good.
You were about an hour post-op, would you say? Do you have any pain?
Nothing.
So on a 0 to 10 scale, a 0?
I'm pretty sure that you've mastered the art of pain mitigation.
Well, I have a lot of help in that regard, but yeah, that's great to hear. So you had a little bit of nausea at first. Are you better?
Yeah, I feel like it's almost like routine for me to get a little nausea post-surgery.
Sure.
Yeah. But I'm not better now.
Well, you are fully sculpted in your flank area. We removed all the skin I marked and quite a bit of subcutaneous fat underneath. Really cleaned it out, so you'll have a nice sort of kind of aesthetically ideal transition from low back to buttock. I mean, it's going to be.
Did I get a butt lift?
And you got a buttock lift out of it. So we talked about how much the surgical specimen would weigh. And I said maybe 1,000 grams. And
Yeah,
what did
so
you think?
2.2 pounds. I said 3.8 to 4.2.
Pounds?
Yeah.
Okay. Well, there's an old adage in business, practice of business, under promise and over deliver, right? So I thought if I said what I really thought it would be and it fell short of that, you'd think, did you remove enough?
Yeah.
So I thought it would be between 1,500 and 2,000 grams, and it was 1,900 about, I think. So
Grams?
almost 2,000 grams, so almost 2 kilos, which is about just under 4.4 pounds, so you nailed it.
Crazy.
Yeah.
I got it right. Oh my God.
I was holding your flanks, sort of grabbing the excess in my hands and thinking, this is a lot more than your average breast reduction. And the average breast reduction specimen will be, commonly anywhere from 600 to 1,000 grams.
No.
So I thought, say 1,000 grams, and it's going to be a lot more.
Wow. I can't believe I got it right.
I mean, it's been, how long now? Are we 6 months on the chest?
I guess closer to 8 now.
8. Yeah. So I tell patients, for chest scars, for gynecomastia, for a total excision procedure, expect it to take 2 and maybe even 3 years for them to fade completely. To be this faint at 8 months is fantastic.
Yeah. I mean, it's the thing about the surgeries that you perform is it doesn't take away from the look, it actually accentuates. It literally makes my chest look bigger because it creates a shadow underneath my chest.
Right.
Which is ridiculous.
Well,
I remember you saying in a post that you're not a magician. I'm not convinced.
Well, I had good teachers, good mentors, and was in residency a long time,
No.
and have been working to master it for a long time. So it's not magic. It's just I think good training and a great team that helps me, supports me.
I'm not convinced. I think you're like Gryffindor or something at this point.
And then just following surgical principles to get the best possible outcome.
No.
But I'm so excited. We've gotten stage 3 of 3 completed.
That's no words.
And you're pain-free in the post-op area for the 3rd time.
Nothing.
So,
Yeah. Thank you so much.
absolutely.
As always.
So reach around here and feel that area.
Oh my God.
It's gone.
What?
I thought I would feel happy, and I did, but I think I was in shock.
What?
Yeah.
That's crazy.
And on Friday, I'll show you the photographs.
Oh my God. Wow. That's crazy.
All right, my friend. I have to go see another patient, but I'll be back in to see you before you leave.
That's good. Thank you so much.
My pleasure.
Yes.
But then something happened that I didn't expect. I started to cry, quietly. Not because I was sad, but because I was grieving.
You're not looking what you're feeling, right?
Yeah. Sorry.
I was grieving every version of myself that did make it out.
every version of me that hated himself, every version of me that thought he didn't deserve love unless he looked different. I was grieving that war. It's when you fight for so long, you don't realize how used to the pain you've become until the pain is finally gone. And then there's silence. And I was just sitting in that silence wondering, what do I do now? I spent my whole life trying to escape my body, trying to outrun my past, trying to become someone else.
I have nothing in the tank. I have nothing.
This journey had cost me everything. My job, my friends, and especially myself. My issue is that I was going to war with my own body, and not once had I had taken the time to slow down and feel something. So the second I took my foot off the gas and had Taylor saying, "I know you have more to give," I got hit with flashbacks of all the bad in my life. 30 years of being the end of fat jokes, the bullying, having to take a deep breath before tying my shoes, hiding my food so nobody saw it, eating fast so I could eat more before feeling full, ordering Uber Eats every single day, comparing myself to the perfect bodies of social media, and blaming my genetics and my Crohn's disease. Letting myself feel something was the first step towards healing. And now we're here. And for the first time, I don't need to run anymore.
No problems with activity?
No, the only thing that's been weirdly annoying is that, again, I didn't realize how much I used my fat pouch before. So laying in bed, apparently my glutes are a little bit more developed than I thought they were in my back, so that my lower back doesn't actually touch the bed anymore. So my lower back is
I see. So that was your main point of contact,
Yes.
laying on your back.
Not anymore.
Yeah.
So I have to put a pillow under there to sleep for the next little bit or something.
Until you get accustomed to it.
Exactly.
Back lift, flankplasty, buttock lift. Whatever, it accomplishes all of the above.
I haven't seen this yet either.
All right.
Do you have a mirror? I want to do that.
The new you.
That is so weird. It's like
So-
it's as if what the hell?
Let's see. So if you don't mind me
Yeah,
showing
yeah.
you the top, I mean, that is like
What? Oh my god!
a major caboose improvement.
Taylor can never have small glutes ever again.
And what a lot of people say is, I finally look like the mental image I have of myself, right?
That is the perfect way to word what I felt this morning looking at that.
Yeah.
Yes, thank you. That was perfect. Which begs the question of what could possibly be next. The first year was about proving to my loved ones that I was worth it. The second year was about proving to the world that it was possible. This third one this one's for me. This is my phase 2. And yes, I know, fuck, that's the wrong year. Don't ruin the moment.